as we build from this present focus on communicable diseases, we at the same time see rising non-communicable diseases in a globalizing world. And Chapter 11 looks to efforts to implement human rights, to prevent and control tobacco use, and focus on obesity-related diseases.
My name is David Patterson, speaking also for Professor Bridget Tobes from the University of Groningen in the Netherlands. I would like to congratulate Larry Gostin and Ben Meyer for assembling such a comprehensive and rich collection of perspectives on global health and human rights. Bridget and I were delighted to be invited to contribute this chapter, which explores how human rights norms, principles, standards, and mechanisms can be applied to non-communicable diseases, or NCDs. This perspective is important because today, more than 7 in 10 deaths worldwide are related to NCDs, and more than 1/3 of these deaths can be considered as premature, which means they occur in people under the age of 70 years of age. This is not only a rich world problem. Over 85% of these premature deaths occur in low and middle income countries. NCDs are increasingly perceived as a human rights issue because they are largely due to preventable risk factors related to tobacco consumption, the harmful use of alcohol, unhealthy diets, and a lack of physical activity. State obligations arise because these risk factors are largely within state influence or control. The chapter is divided into 3 parts. Part 1 addresses the history and current trends in the NCD pandemic. It focuses on the major risk factors of tobacco consumption and unhealthy diets. This part also notes the evolving legal and policy responses to these health threats within a human rights framework. Part 2 outlines the current human rights approaches to respecting, protecting, and fulfilling rights in NCD prevention and control. Most importantly, it recognizes the importance of the right to health in facilitating corporate accountability for the so-called commercial determinants of health. We discussed the examples of tobacco corporations appropriating human rights language to undermine health regulations in the Americas, and beverage corporations taking legal action to limit civil society campaigns to reduce sugary drink consumption in Colombia. Part 3 suggests opportunities to strengthen the legal obligations of states to respond to NCDs. It notes new sources of international law, including proposals for new treaties, such as on business and human rights, and the evolution of soft law in this field. This part also examines the interaction of international trade law and NCDs, and we discuss how one country, Samoa, ran foul of WTO rules when it tried to limit the importation of high-fat foods. This chapter concludes that overall, human rights standards provide a strong framework for addressing the commercial determinants of health in preventing NCDs. In the 21st century, human rights have become more important than ever in promoting global health. This is equally true in the case of NCDs, and we hope that this chapter will inform and inspire students in this field.